welcome and good morning to all the Life Pharma Coalition students and viewers. So once again, welcome back. So let me share my screen without wasting much time. I hope the screen is visible, right? So welcome to the India's longest web series of live learning, that is Life Pharma Coalition LPC-43. So LPC disclaimer, LPC is an online discussion and it's a non-profit initiative having no commercial intent, and views expressed by speakers, panelists, moderators are their individual opinions based on their experience and having no concern either with their organization or to Life Pharma Coalition. So this is our disclaimer. And as a ritual, we would like to congratulate all our active participants during our LPC 42, which was on international. I hope most of you guys got a lot of insights on Russian market, Africa, and Southeast Asia markets. So these are from Facebook. Santosh Kumar Vajinapalli. Congratulations, Santosh, for your active participation and asking great questions. And Pramod More. Congrats, Pramod More. And thank you for asking very intuitive questions. And Kuldeep Solanki, as again, Kuldeep was very active and very great fan of Life Pharma Coalition. And Himanshu Dwivedi. Congrats, Himanshu. Okay, from YouTube, we didn't have much question. Probably there was a problem with the YouTube. The comments was disabled during the live, so we didn't have any comments from our questions from the YouTube. But anyhow, we all thank all the YouTube viewers from last LPC 42. And once again, thank you for attending this Live Pharma Coalition. Today, we have with us 3 musketeers from marketing, because we all know that whatever the brands we see, whether it's a great brand, whether it's a favorite brand or anything, there are 3 things which are very, very visible. One is how you launch from the beginning, how you nurture your brand from the beginning, and what kind of strategies that you implement to make the brand a great success. And recently we have seen that the customer-centric approach, which has led many brands successful during our COVID-19. So to address this, we have 3 musketeers from the marketing, and I would like Yashwant to introduce the speakers. Thank you, Yashwant.
Thank you, sir. Thank you very much, ICS, sir. And good morning, everyone, viewers, and welcome to Live Pharma Coalition. First of all, thank you very much for joining us live and supporting us, encouraging us to take the Live Pharma Coalition way ahead. You all will agree that pharma industry across is gearing up for financial year 2021-22. After a debacle and setback in the last year, it is time to fasten your seat belt and face the challenge of 2021-22. Exactly, and all across industry is planning the strategy, and product managers, brand managers are formulating their brand plan. So in Live Pharma Coalition also, we thought there should be a session from experts, subject matter experts, on what are the different angles and dimensions of brand plan. So today we are here with an exclusive episode of Live Pharma Coalition on brand plan. And to address this, we have the eminent musketeers, as ICS had told, Mr. Sanat Kumar Sahu, DGM Marketing, Induco Remedies, Mr. Sunil Chilkanwar. He is Group Product Manager from Sun Pharma, and our own Raman Marke, Vice President Marketing, Entod Pharmaceuticals. So they are going to share with us different dimensions of a brand plan. So let us hear from them. What is it they are going to share with us before going to individual presentation? So I would like to ask Mr. Sanat Sahu. Sanat, welcome to Life Pharma Coalition. Please give a brief overview of your topic.
Yeah, thank you, Mr. Yaswant, and I'm really thankful to the forum of LPC, the way it has been designed and the consistency which have been carried out for last almost 8 to 10 months, which has been from the inception to till date. The consistency was really great. And I'm really thankful to all the audience who have joined us in this Sunday morning first hour. Those persons who are very serious about growing in life, they only dedicate this time. So today I'll be discussing about, it is not a known thing, but it is a very interesting thing which is coming out very promising with the course of time. It is about patient-centric approach, that how a patient plays a vital role in today's marketeer's mind. Gone are those days when the doctor, if I'll be talking about pharma marketing, it is about doctor and the pharma company. But today for a doctor, it is more about his patient. And if we are able to address his issues, then definitely it will help us to address the issues of a doctor. So we are taking care of the customer's customer. In that way, it will help us to build our brands. So I'll be discussing in length about this during my presentation, and I would be eagerly waiting for your live presence at that time. Thank you.
Thank you very much. Thank you very much. Wonderful topic. We are looking forward to learn from you. I would like to ask Mr. Sunil, what are you going to share with us, Sunil? Unmute, please unmute.
Thank you very much, Yashwantji, for the introduction. So first of all, my topic is handling large pharma brands in Indian pharma industry. So first of all, thanks for LPC team for giving me this opportunity. And every Sunday morning, 11 is a learning hour for all of us. And today I'm lucky enough to share something. So today I will be sharing, I was associated with 3 large brands in which fall under top 10 category. So I'll be sharing what are my experiences, how we manage the PLC of this brand, and how we could boost the revenue, which are the different strategies we use. And also I would like to add a few case studies of the industry, which I feel are the best case studies in terms of product modification or market expansion, or be it any marketing mix. So it would be more of a industry experience and my own experience. So looking forward for a great contribution and learning from all the key speakers.
Thank you very much, Sunil. Thank you very much. And last but not least, our own Raman Barke. First of all, many happy returns of the day, Raman. It is the right coincidence that today is your birthday, and we have you as a speaker. As entire viewers know, Raman is the founder of this Life Pharma Coalition, and it has come to a lot of journey with the team effort. So, Raman, once again, thank you very much for accepting our request to become a speaker on this auspicious day. What is the thing you are going to share with us?
Yeah, so thank you so much to Yashwant sir, ICS sir, all our 3 speakers, Arpan, for the best wishes to me. Thank you so much. So when it comes to the LPC-43, so first I would like to hello to today's Live Pharma Coalition, that is a 43, our speaker, moderator, and panelists, and all our the Facebook and YouTube viewers, audience, people to whom these online discussions will reach. As you know, I'm Raman Marke, currently working with the Entort Pharmaceutical in Mumbai as a Vice President Marketing. And today I'm here presenting a new product launch plan in the new normal era. When we say a pharma products, all gets attention toward the Indian pharma market. That is our IPM. So in the presentation, I will touch upon the number of the products into the IPM, new product examples which has been launched in the recent past, since for last 6 months, the product which has been introduced into a market, challenges in the new product, and way to overcome it. Also, after that, we will look at the various steps to be taken into a consideration during the new product launch, and how to make this successful pharmaceutical product launch plan. This I will try to cover it, this 4 points. Now over to our LPC-43 moderator and the panelists to start the today's first online discussion. Over to you, sir.
Thank you very much, Raman. So we can say that all the three dimensions of brand plan we are going to cover with the subject matter expert. Really, a learning is waiting for everyone. And with me and ICSR, we have moderator Mr. Arpan Kumar Paul. He is known as a storyteller in the entire vicinity. So Arpan, what is your thought on brand plan in today's contest?
Thank you, Yashwant sir, and good morning to one and all on LPC-43 Young Platform. First of all, Raman sir, very happy birthday to you and many happy returns of the day. And what a wonderful coincidence that today we are having you not only as a panelist, but as a speaker on LPC-43, where you have been a founder. So the journey that LPC has embarked for the last 8 months, and we have really come a long, long way. And in the endeavor of spreading learning and development, I think LPC has become the #1 non-profit organization which conducts every Sunday a wonderful learning session. So first and foremost, Raman sir, like he said that about marketing in this new normal, COVID was never a death sentence that was announced to the pharmaceutical industry. Rather, it was a story which called for innovation, for rediscovering our strengths and also overcoming our weaknesses. So in this context, I am just going to tell you a small story where we should always try to focus on our strengths. We all know that the snake and an eagle, they always fight with each other. But when the eagle tries to fight with the snake, it does not fight with the snake on the ground. What it actually does, it carries the snake to the sky, where the snake feels very helpless, because sky is not the strength of the snake, but sky is the strength of the eagle, because it loves to fly high in the sky. And that is a moment of time where the snake is absolutely useless. It is absolutely harmless. And that is where his weakness lies. So this is how the eagle overpowers a snake. So in a similar way, in life, we should never compete with our adversary in his own comfort zone. Rather, we should change the battleground. So in our professional lives, let us first identify our strengths and weaknesses. What we can basically do that we can grow faster if we concentrate on strengthening our strengths instead of focusing on our weaknesses. So if anybody is falling short of our goals, it is time that we consider trying to improve where we are already strong in, because it will always give us an edge over the competition. So thank you, Raman sir. Thank you, ICS sir. So I hand it over now to Yashwant sir to start the proceedings for this wonderful Sunday morning. Thank you, sir.
You are on mute, Yashwantji.
So thank you very much, Arpan. Nice story in the today's relevant topic. And with that, we'll go to the first speaker of the day. And Mr. Sanat Kumar Sahu, we request Sanat to share his presentation. Sanat is coming with 15 years of experience in pharmaceutical industry. He is a soft skill trainer, marketeer, and also a consultant. Not only that, he is a value creator and also brand builder. So this 15 years of journey, he's having education-wise, he has done B Pharma and MBA, and he is having expertise and he is known face in the pharma industry. So I request Sanat to share his presentation and take us through the journey of patient-centric approach in pharmaceuticals.
Right. Thank you, Mr. Yaswant, and good morning once again to all the viewers and to all the panelists for giving an opportunity to share my view and my learning over here in this platform. And I'm sure by the end of this today's meeting or today's presentation, I'll be able to add certain value to you as a part of pharma market here. So is my slide visible right now?
No, please.
Okay.
No.
Just a second.
Yes, now coming.
So I'm making it full screen.
Yes.
So already, thank you, Yaswantji, for sharing such good words about me. Couple of things which I narrated over here, like as a speaker, as a consultant. I'm a student who has been putting his best effort in learning every day. I have been consulting with different people of different age group and different responsibility to understand and to help them that what I have and how I can contribute. So as a brand builder, it is my passion that how I can contribute and how I can give more and more to the society in form of either a brand which will help someone's blood pressure or which will help someone's glucose control. So why I'm talking about this, because there are the patient-centric approach, which my topic is all about. It is in detail about that. So, as already has been briefed, the disclaimer that the thing which I'm going to present in next 15 to 20 minutes, it's all about my experience of last 15 years in this industry. So it is not sharing anything which the company may or may not be giving a permission about that. So the patient-centric approach is the key to win. So gone are those days when the doctor and the pharma person plays a very vital role in strengthening the relation, and what have been prescribed by the doctor or what have been communicated by the pharma company to the doctor, that will be coming onto the prescription. But today the patient plays a very vital role. They are more matured. They have lot of resources, to understand about what is happening between pharma and the medical fraternity, and the end product which they are getting prescribed, whether it is right or wrong, or whether it is required or not required. So in this way, a lot of things are being debated, and I'm sure you must be seeing a lot of forwarded messages that the doctors are not entertaining the patients who are coming with Google messages. So even there are certain sarcasm statements which have been placed in the doctor's waiting area. Don't visit Google, and if you visit, please don't ask about those things. Rely on me and my prescriptions. So this is coming because the half the knowledge is not going to satisfy the need, and the doctors sometimes feel that they need to have a communicate to their patients related to all these things. So building corporate image through social media is one of the most important thing. I feel my images are not coming. Can I request the team over here? Probably the images are not coming. Yaswanji, if you can help me, the presentation is there with you also. My images are not coming actually.
Okay, okay.
Just I'm once again trying, otherwise you can say, because while doing that, I was also seeing that there are certain pictures which are not visible to me. Yeah, and the image part with relation to ID was not found in the file. So please, I request if you can open the slide on my behalf, I request.
Yes, just a minute.
Sorry for the inconvenience.
No issue, no issue.
Yeah.
Yes, it is visible. And now you see just visible now?
Yeah. Right. No, here also okay, fine. There are few pictures which are placed which are not visible. Fine. Yaswanji, I'll request if you can just cancel and I'll update. The certain photographs are not placed.
Just
Are
now you
not,
have shared. Just now you have shared
yeah,
this one.
Yeah.
Okay.
So
I'll stop.
Yeah. You please stop. I'll do that.
Okay, no issue, no issue.
I feel the
No
pictures
issue. Go
which have
ahead.
been placed.
So you're going to share, Sanath?
Yeah. I'm sharing.
Okay.
I'm
Okay.
sharing.
Okay.
Is my slide
Yes,
visible
yes,
now, right
visible,
now?
visible,
Yeah.
visible. Perfect.
Yeah. So what I was talking about, the patient-centric approach, which is key to win, because now the patients have n number of sources to get enlightened about what the disease is all about, what medication is really required from them. And they, out of curiosity, number of time ask n number of questions to the doctors, to the medical fraternity. And doctors had also realized that in order to overcome competition and in order to serve their patients in a proper way, they need to have knowledge sharing activities with the patient so that the patient can get benefit out of it, and the dilemma of keeping them in confusion can be moved out. So here, as a part of pharma marketing, it's about building corporate image through social media is one of the most important thing in today's date. I request somebody's mic is mute. Yeah. So as a company, I need to build my image in the patient mindset. Then only my brand's acceptance is there. During this lockdown, from the March onwards, if you see the brands which have been accepted well, the companies who have been are known by the patients much are being appreciated or are being purchased. The local brands, the brands which doesn't have any face value in the patient's mind, are being ignored, are being not taken. The same happens to the medical fraternity also. Those companies who are well established, those brands which are well established, the emotional connect which the brand is having for the doctors, for the patient, they are being accepted during this lockdown. So what I want to state over here, that with the course of time, the corporate image plays a very vital role in the consistency of the brand getting accepted by the medical fraternity or the patients. And the thing which are being overcome through the bridging the gap is only possible by utilizing the different sources of social media, may it be LinkedIn, may it be Facebook, may it be YouTube channels, may it be Instagram. All these things, the things which are being more visible, can be communicated to the patient level about the issues. I'll put a small example over here of my experience, that there are certain chronic therapies like hypertension. Hypertension is a disease which is also known as silent killer. So today you will be finding a lot of information on the net, through Google, through Facebook, through YouTube channels, that how a patient can get detected, who are the patients who are liable to suffer from hypertension. The patients want to understand this. If they come across some the symptoms, and if they come across something which is helping them to understand the disease in a proper way, they inquire about the same to their family physician, and the family physician helps them in understanding the diagnosing the disease and help them in treating the disease. So what we want to say over here, that this information, the company who shares this information with the patient and educates the patient on a particular disease, educate the patients on the treatment procedure, educate the patients on the frequently asked questions, those companies are being accepted by the patients, and those companies are being used to have a mind space in the doctors. Those companies used to have some space in the patient's mind, and in this era, it is required those companies who put effort in developing such or in such knowledge sharing forums that will help to come closer to the patients. So the patient funnel is much clear and much well established for almost a decade's time. If we talk about here that the patient are more about online discovery, they want to, whenever they come across something, they want to go through it, Google it, they want to ask it, and then they understand what is the thing related to this particular disease, or the treatment procedure, or the diagnosis procedure, or the post-treatment procedure, what is happening. They want to understand that through the online media. Then the message or the content which are more appealing to them, which satisfy their need, then they start developing a trust on them, that particular source from where they are getting. Either that can be a company, either that can be a brand, either that can be a therapeutic way, either that can be a doctor pool. So based on that, they start developing after getting a particular message which they want to understand. If they get correlate to that, they start developing trust to this. Then comes the new patient conversion. So if I am going to place something where the patient have understood that what diabetes is all about, during diabetes, what are the things which are going to be taken care. And if I'll be those people who are in LinkedIn, I'll communicate him like Dr. V. Mohan, who is from Chennai, one of the Padma Shri awardee winner, who had started this LinkedIn forum that he used to share small snippets about what diabetes is all about and how to take care of diabetes. His YouTube channel also he had developed, and on LinkedIn periodically he used to update, and very soon on 23rd his book will be published. So why this doctor, after having so much of name and fame in the field of diabetes, is putting this much effort at a regular interval? Because he wants to contribute to the society, those who are suffering from diabetes, with his expertise knowledge, how they can get benefit out of it. And if this one of the patient understand this, he follows him, the same thing can be passed on, the same can be shared with other patients, and more patients can be getting benefit out of it. So this is about that it goes multifold when you are using a thing which is related to the patient-centric approach. If the patient gets benefit, he, with the mouth publicity, with his like, with his share on the social media, n number of other people who are associated with him will get benefit out of it. There are patients who are committed to them, those who want to judiciously see what Dr. V. Mohan or Dr. Sasank Joshi or Dr. Bansi Sabu or Dr. V.M. Makkar have been doing in the field of diabetes. They want to periodically understand. And those patients who are from this doctor's patient pool, they usually share this information with their core group, and that helps in the publicity and in the knowledge transforming process. And these are the patients who actually act as a carrier for passing the message from one to other. So in this way, the patient funnel helps a doctor or a knowledge content to the disease or to the therapy or the medication or the related things related to diagnosis or how to manage the disease are being transferred to the next level. The most important thing is about identifying the unmet need of the patient. Here plays, as a marketer, we need to understand that how to engage patients through different routes. So earlier, if I'll be talking about during my initial years of my career, we have been talking about that what I'm going to communicate to the doctor so that I can have more mind space of the doctor and my product will be prescribed by him. Now the time has changed. With the evolution, we need to involve a patient-centric approach, that what my doctor is visualizing in the patient when somebody enters to his clinic. And after going through a particular diagnosis, after counseling the patient, what are the difficulty the patient shares with him, and how my product gets fit into that particular need of the patient. If I am able to address in a proper way, then I'll be able to have more mind space of my customer, that is my doctor, and that will help the brand to get more prescribed. So here I'll be talking one more example about that the metformin as a molecule is not being dissolved in the alimentary canal, and most of the time it gets relieved or through the stool as a ghost stool, where the efficacy of metformin is not properly absorbed by the body. So, and this is one of the property of the metformin, because of which most of the time the doctors were not able to give the right benefit to the patient, and the patient is not able to get the optimum utilization of the metformin in the body. That is the reason with one of the brand which we had developed a technology called as that it forms a jelly-like substance and sticks to the wall of the stomach. So metformin, the ghost stool which has been identified, that most of the time the patient complains that while stool is being taken, the tablet comes out and the desired glucose level which the patient requires is not being met. And taking this clue, one of the pharma company had developed that we are going to develop our metformin along with the, in coordination with the R&D. The metformin is developed to form a jelly-like substance when it comes in contact with the stomach secretion, and it sticks to the stomach wall, and slowly the metformin is being released. So these are the things which we need to talk about with our customer, and it will help the patient will be able to fulfill the need of the patient. This unmet need will help the patient to have the desired glucose level control. Next is about what value-added services to the patient we are giving, like a chronic therapy. When a patient has to take medicine for a long time, and adherence is one of the key issue. When the patient doesn't want to take medicine every day as per the doses which has been recommended by the doctor, most of the time he has one or the excuse that he misses the dose. So the desired goal which the doctor expects with the patient need is not being met. I'll put a small example over here. The package or the packaging has been worked out. Instead of giving 10 days therapy, the packaging has been improved to 15 days. The packaging has been improved to 30 days and to 60 days also. The main reason behind this, that if the patient is having the medicine is at home, then the patient is going to take. If the medicine gets over, then purchasing may get delayed. So as an elderly patient, if he is going to purchase the monthly therapy, the 60 tablets or the 30 tablets or 15 tablets, the chances of improving adherence will be much higher. So this is about how the value-added services which we can contribute, involving patient to understand the requirement. We need to have a core panel of patients for the particular disease, for the particular profile which we are working, for the particular therapy which we are working, so that these patients will help us in understanding that what they require. The patient who are suffering from this diabetes, they feel very thirsty, and if they drink more amount of water, the polyuria happens. They have to go frequent urination, and that is a disturbance at a very elderly age. The patient who have been suffering with diabetes for almost 10 to 15 years, and at the age of 75, it is very difficult for him to take care of all these issues which are related to diabetes. May it be polyphagia, may it be polyuria. In that case, what are the things which we can develop in our brand where there will be less amount of water consumption, or where the patient doesn't have to drink enough water, which is excess water, which is not required by the body. So we need to coordinate with our R&D to develop such things. Identifying the pain area, those patients who are suffering from arthritis. I have been citing a couple of examples where I have directly or indirectly involved in my career. Like identifying the pain area is about arthritis patient, particularly during the winter, when the patient at the age of 60 who is suffering from osteoarthritis, after early in the morning, if he wants to get up, the joint pain is one of the most dreadful things which the patient feels. And to overcome that, one of the brands which have been developed, and I was not directly linked to it, but I have understood the process, that how this aceclofenac can be given at a sustained release form, which gets the therapeutic action in the early part of the day. The patient has to take the pill in the night during the dinner. There will be an instant release which will help the patient to overcome the pain during the night, during his sleep. But during the early hour from 4 in the morning to 8 in the morning, that those 4 hours where the patient normally gets up after sleeping for almost 6 to 7 hours. So there the joint gets stuck, and when he moves, gets up and try to move, the joint are not flexible enough, are not able to, they are not able to move properly. And that was one of the pain area of osteoarthritis patient, particularly in the winter season, where they have to get up in the morning, and during first 2-3 hours is a difficult. So one of the brand which have been developed, that instant release aceclofenac and sustained release aceclofenac. This sustained release aceclofenac has been put in such a doses form that during the early hour, that is from morning 4 to 8 in the morning, those 4 hours, the aceclofenac is being released in a controlled release form, which helps the patient to overcome that pain. So these all things can be worked out. So in order to understand from the patient, we have to have a panel of patient, the therapy where we are dealing with. We need to understand from newer patient, from different age group, from different male or female, elderly patient, young patient, office going patient, those who are retired. So we have to have a pool of patients who can help us in getting this information, and by help with our R&D, we'll be able to modify the doses in such a way that those problems, those pain areas can be addressed. So this requires a smart consulting. Customer insight study is one of the most important thing for a marketer today. It includes the patients where we are going to give our doses, the end customer who is going to consume our product, what is his requirement. We need to have those insights. The healthcare workers, where we need to understand that what are the patient type they are getting, what are the frequently asked questions, the complaints the patients comes with, and how we can help them. And the policymakers. Here I'm talking about the policymakers, the guidelines. As a pharma company, we need to join hand with the associations to develop these policies, that in which disease, which therapy, which patient requires which type of molecules. So those guidelines will help more and more doctor to have a better practice, and more patients can get the benefit out of it. The second is about benchmarking studies. So we need to be very clear and firm that what is there in our organization and what is there inside outside our organization. There are certain things which we can control as a pharma marketing person, but if the product is not able to sell, if my sales team is not able to deliver those things inside the doctor's clinic in a proper way, then it is my responsibility how I can train him in a proper way, how my in-clinic excellence can be further improved, so that we will be able to address the issues in a doctor's chamber in a much better way, so that the doctor gets convinced and the doctor will prescribe my brand, and ultimately the patient will get benefit out of it. Next is about development of the strategic plan. It's very clear, friends, in today's era, if we are not able to address these issues in a proper way, if we are not able to deliver these things in a proper way, then definitely overcoming competition or getting mind space of the doctor is not that much easy. The way the patient gets exposed to a number of things, the way the healthcare professional get exposed to a number of things, if you aren't to develop your own identity, your brand identity, your company identity, then you have to hit the bullseye in such a way that what requirement the patient comes with to the doctor's chamber. And if you are able to give the solution, then definitely it will help your brand to get recognized. So challenge of thinking and support to the formulation is much more important. So you can't just have a carpet bombing everywhere. You will be sharing everything. Suppose if I'll be talking about vildagliptin today, almost 90 players are there, and everybody is talking about the SB1C control with vildagliptin. So if I'm not going to be specific that how my brand has an emotional connect with my customer or my patient or my end user, then if not that I'll be able to do, then for them doctor, there are 90 brands, and every day if a doctor meets 10 pharma companies, then mostly around 8 companies will be talking about vildagliptin as a molecule without any brand identity, and the doctor will not be able to recall your brand, which when he requires to prescribe for a patient. So you need to have your brand identity, and that will help to have a better mind space when the patient comes with the problem. If you are able to correlate with that pain area, if you are able to correlate with that problem, your brand will get noticed. And strategic seminar facilitation, it's about all preparation, friends. Today, if I'm able to say these examples, that means for last 15 years, we have been working on one or the other ways, and I have been learning from one or the other product managers, from the marketeers, that how these things can be worked out, how the patient-centric approach is one of the key area, to differentiate your product, to have more mind space of your customers. So the customer insight studies are need to be done in a proper way before developing the strategy. So you need to understand what the requirement is all about. Based on that, if you are able to develop your strategy, assessing the attractiveness of the market, in which market you are playing. I had quoted a couple of examples from different therapeutic area, like from osteoarthritis to the diabetes to the hypertension. So if you are able to see that your brand proposition is having a scoring point, and among the indirect competitor or among the direct competitor, if you are able to identify such one thing and you are going to develop a strategy based on that, then you will be able to score much, much higher. The growth strategy is only based, or what is one of the very key point which will help you to come closer to these doctors and to get more prescribed by the brands. It is all about if there is no which is going to have the declining state, provided if you are going to identify one of the key area where your brand can be taken to the next level once again. So in the PLC, if your brand at maybe 80 crore or 100 crore, and it has started declining, or the market has become more matured, what has been identified, because the market is not going proportionally high, then the time has come that once again to identify one of the key issue which the pain which the patient comes with to the doctor, and how your brand can address those issues, that will help to propel once again the brand to the next orbit. And from there, once again, as a new brand, it will start featuring. The bigger brands also requires today the different strategies of the new entrants, because eroding your market share is one of the very easy things if we are not able to address. So for bigger brands who have a very big mind space in the doctors, as well as the acceptance at the patients are much higher, need to develop that how the space can be further strengthened, and without the influence of the new entrants to get it eroded. So those strategies need to be developed based the patient insights. Based on that, the management has to take care of it, the facilitation and the structuring of strategic thinking for multi-dispensary products. We need to work out on that part, that how your brand can have a multi-dispensary approach, that what need to be communicated to the doctor, keeping the patient insights in that, what need to be communicated to the patient related to keeping insights of that therapy or keeping insight of the disease area where it is, development and implementation of coaching program. The thing is that, friends, what we are delivering, maybe that 30-second or 1 minute in the doctor's chamber, that comes out with lot of insights which we gather from years and the experience which we used to get from patients as well as from the doctors. So those need to be developed in such a crispy way that it hits the bullseye in those 30 seconds where the doctor is opening or giving attention to the pharma person. So your team should be so smart enough that that 30-second will be utilized in a proper way. The organization improvement of sales force effectiveness is one of the most, where a lot of companies are putting best of their effort, best of their resources to train team to the next level, so that that 30-second can be utilized in a much, much better way. Improvement of the distribution channels covering hospital and retail markets. So if you are able to get space of your mind space of your customer and the end user, that is patient, the next thing which is required is about the availability part, how easily your brand is available to the patients. So you are able to actually close the loop with this. So advantage of patient-centric approach is very clear, friends. The increased engagement is one of the most important thing. Engaging patients, engaging caretakers. There are certain cases at an elderly age, the patient may or may not be able to recall all the things. So the caregiver, the caretaker plays a very vital role. So how we are going to train those caretakers so that the disease can be taken care of the patient. So there are a lot of insights which are being taken in regard to this. And osteoarthritis patient at a very elderly age, those patients who are suffering, how to take care of them, or in diabetes patient, or in uh, hypertension or cardiovascular diseases, those patients at the age of 80, they are not able to recall which medicine to be taken, and how you are able to differentiate your product from the Me Too market, from the brands which are available in the market, plays a very vital role. Enhanced knowledge of the patient, enhanced knowledge of the caregiver, that why brisk walking of 30 minutes a day helps a patient to have a better health, why salt intake less than 6 grams is actually advisable to the patients. So those are the things which we need to enhance our patients' knowledge, that will further help for a better society, for the patient to live healthy, understanding among patients and their own health. So we need to periodically update these patients on this better care lead to better life. And it is about in decision making process, how we are actually involving the patient, that the drug is OD, BID, TID, how the pill burden can be reduced, why the fixed dose combination is going to be beneficial for a patient. So these issues, these insights actually a patient can give. And if we are going to dedicate some amount of time and resource for this will give you a lot of insight, and these insights will able to differentiate your brand from the cluttered market, may it be direct, may it be indirect. So increased competitive advantage is one of the most important thing which is required, because now the market is very, very robust. The doctors are being bombarded by n number of companies with n number of brands. The patient is being able to see a lot of information from different sources. So identifying, spending time on understanding the things in a proper way, what actually the patient requires, and strategizing and developing key notes for that, and the tactics as well as the strategy based on that will actually help you to differentiate your brand and to get more mind space of your customers. So better quality of life for patient leads to an increase in both patient and doctor satisfaction. So with this, my presentation is come to an end, but let me put in this way, friends, it is just the initiation. A lot of work we need to do in related to the patient-centric approach, the way the market is getting cluttered, the way the competition is ahead of us. We need all the insights, what a patient requires. If we are able to address those, then definitely we will be able to build a brand. Thank you all. My presentation is over. If you have
Thank
any
you very
queries, quick
much.
question, one or two.
Yes, yes. Thank you very much, Sanath. Really a comprehensive presentation, I can say. This not only talks about the content you have discussed, but also the passion, the way you have delivered. This shows how grossly you are deep into the brand position and involved in particularly patient-centric approach. We all will agree now that patient is the core of pharmaceutical business, right? That is what. So everything a brand manager is trying to do, make patient should be at the center of the every circle, right? Or the fulcrum. Thank you very much. Before going to the question answer next session, a quick recap. It is very difficult to recap everything, but a quick take-home message. What you have told is patient-centric approach starts with the building corporate image through social media, and you have explained about a patient funnel, how patient funnel is developed. First of all, patient will do the online discovery. Then, after the discovery, he will build the trust about the brand. Then new patient conversion will happen. After that, a committed patient, once the patient will use the product for many times frequently, he will become a patient, committed patient. And then, like a roving fan, he will become a vocal advocate of your brand. That is what a wonderful approach you have told. And some smart consulting approach you have told, that is also very good. Identify the unmet need of the patient. Very, very important. Brand manager should keep in mind what are the needs of the patient and how I can address those needs. Second thing is engaging patient with a differential route. What are the different ways, social media, direct approach through doctors, through education program, how to approach and engage the patient, particularly in chronic business like diabetes and hypertension. And you gave an example of novel drug delivery system of metformin, how it is technology is done to understand the need of the patient. Then value added service, very very important, how we can offer value added service to the patient, and involving the patient to understand his requirement, and last but not least identifying his pain area, that is very very important, and then involving the R&D, research and development, so that we can find out the solution. Really very much useful, Sanat. Thank you very much for giving please keep in tune. We will come to the question answer. Before going to the next session, a quick thanks for all the viewers who are watching. Mr. Akula Rajnikant, Ramesh Juneja sir is there, and he is also appreciated your presentation. Thank you, sir, for coming live. Mr. Manish Tharwal, Madhuri Doshi, Sudeep Bhaumik, Om Sri, Leena Lodha, and Senthil Iyer, Minakshi ma'am, then Kuldeep Solanki. Thank you very much, all of you, for appreciating the presentation. We will come to the question answers a little bit late. So now we'll go to Mr. Arpan for introduction of the next speaker. Thank you, and keep in tune. Thank you very much, all the viewers. Yes. Yes, Arpan.
Thank you, Yashwant sir. After a wonderful deliberation from Mr. Sanat, we have our second speaker, who is none other than Mr. Sunil Chiraknavar, who is currently a group product manager at Sun Pharma. So, Mr. Sunil, if you can kindly share your first slide so that I can give a brief introduction of yourself. So, if your presentation is ready, yes, please. Yes, Mr. Sunil is a BSc with PGDBA in marketing as well as a diploma in creative writing. He has over 14 years of experience in pharma sales and marketing. Mr. Sunil started his career as a territory manager in Cipla and is currently the group product manager in Sun Pharma. The therapy areas which he has in the past and present taken care of, they are in diabetes, antibiotics, nutraceuticals, NRT, and cough preparations. He is also associated with the top 300 brands in the IPM. He is creative, assertive, a digital enthusiast, a go-getter, a team player, and a field collaborator. So, and the most important part is his hobbies are quite similar to mine, that is playing chess. So, welcome, Sunil sir, and it's over to you for your presentation.
Yeah. Thank you, Mr. Arpan, for that kind introduction. And let us just quickly move through the presentation part. So today, friends, hope I'm audible, right?
Yes, loud and clear. Yes.
Yeah. So today I'll be talking about building big, or that means large legacy brands, and what are the important roles. So before going to that, though the disclaimer was there, but still all the views, opinions, and thoughts expressed are all are for education purpose only, and they do not have any linkage with my current or past role. So friends, first of all, let me thank all the LPC team for giving me this opportunity to talk. And I guess if you want to learn something, you need to talk about it. So that's the way I think about it. So thank you for the people who are online for taking out the time from their busy schedule, and thank you for all the colleagues and mentors who have worked in past. And these are the slides which are the result of the learning from them, which they have come across. So friends, big brands, why these big brands are important for all of us. So just a quick look, if you see the IMS numbers, top 300 brands, they contribute almost 32% to the IPM price. So that talks about the volume of these top or big brands or large brands which are contributing to the industry. And if you see, friends, not only these are big brands, but out of these 213 top brands are outgrowing the market growth, which was 4.2% as far as Jan-Mat is concerned. So that means not only these are big, but these are consistently growing above the market. That means they are driving the growth of the market, and that talks about that why these are important. Apart from that, if you talk about brands, why these are important, because friends, today consumers want brands. So if any consumer, for that matter, Mr. Sanat also talk about consumers or the patients. So today nobody goes to a grocery shop or ask for a toothpaste. they always ask for a Colgate or a Pepsodent. So gone are those days when we used to write in our grocery list, I want the edible oil. But now everyone talks about the brand. So consumers want a brand, and this is the area where the brand building comes into the picture. So consumer, the connect between a company and a consumer is a brand. So the brand image is definitely reflected in to the consumers. And next is these have a minimal sales fluctuation during the tough times. Also, if you see, it hardly got fluctuated, and they maintain a healthy P&L because of the good GC part, and then they generate revenues for the future. Because if you do not have any big brands in our kitty, then definitely we do not have revenues to spend for the upcoming portfolio or upcoming new launches. I guess Raman is going to talk about that. So, and that all is linked. So friends, moving ahead, if I talk about big brands, what are the challenges, friends? So I would like to narrate a small story. Like once around five blind people who never saw an elephant, and they had been they had been taken to the elephant, and everyone tried to see what are they watching. All were blindfolded, and someone went near the trunk, and he thought that it's a snake. Someone who touched his tail, he thought that it's a rope, and someone who touched his foot, he thought it's a big tree bark or something. So everyone was watching up from his own perspective. So friends, my take home, or the take home from this story is, every big brand is like an elephant, and our consumer, customer, stockist, or chemist, everyone is watching through his own funnel, and competition is also playing a big part than in perception of my brand. So it's a brand manager's role to show the complete picture of the brand, that it is an elephant, and when it moves, it moves with a steady pace, and it is there to stay in the market for long. So it is a brand manager's responsibility that if your brand is going down, how I can make that decline or maturity phase into once again to the growth by tweaking few things, be it packaging or be it expansion. So I'm going to talk in my later phase of the presentation, friends. So largely, if you see, friends, these are the brands which fall in the matured or declining markets. These are the brands, and sales mostly are declining or stagnant, and consumers are either they are switching for the higher molecules or higher class of molecules. And mostly when you talk about these brands, when they are in the degrowing phase with the field force, the morale is always down. And friends, that is completely dependent on the mindset of a person who is handling that brand. That means me or a marketeer. So mindset of a brand manager is the biggest hurdle in brand growth. If he sees that market is -15, so definitely it will be -20 in coming part. But if he sees that there is a market which is negative, but there are few players which are growing, or he can find out that one insight which can be replicated into the success. So that definitely delivers, and our mindset is definitely reflected in the field. It's what we want to show. Friends, if I just take an example of a basic cell, if basic cell, what a role the mitochondria plays. It's a powerhouse for the entire cell. So we are the powerhouse for our team, which acts like a nucleus, which is the biggest part of the cell, and we should keep it always with a positive charge. And that's what I have practiced in past also, whichever brand I've associated. So the field should be your first team where we need to collaborate, and we should make them believe that this brand has the potential to grow. And definitely once it is there, you should have a science to back it up with, so that you can go, our field can go and talk to the customer, and then the huge share of voice what we create, that definitely brings the magic. Beat the brand is there in the -20% market, or be it the market is growing. So we will always outperform the marketplace. So these are a few of the challenges, friends. So moving ahead, so marketeers should not do more than simply just write that some brand is negative or the market is negative. He should not defend. He should do something so that this degrowing trend becomes to the once again. So what are those things which we can do with my limited experience of last 1.5 decades? I would like to share in coming slides. So one thing which is quite clear, as a marketeer, as a person in sales, we should always dream big and drive better and deliver bigger. Friends, if you do not dream big, definitely you are going to under project for your brand. Definitely you are going to underspend for your brand, and definitely you will underachieve. For example, if your brand is 50 CR and if you are looking forward for 55 CR next year, definitely you will plan accordingly. But if your thought process of 100 CR, definitely you will think big, you will overspend, and you will overachieve. So that's the mindset we all should carry. We all should be going with our career. So first of all, very important thing is you should believe, and then you should make your team believe that yes, this can happen. initially they would resist, but once the magic start happening, definitely they will all fall in place, and so they will talk to you, sir, this is what the success I have been, and this can definitely be a 100 CR brand. No matter if you fall at 90 CR, but you are getting that incremental 30, 40 CR. So that's what dreaming big creates the magic. So there are a few key studies. I know a brand plan is a very big topic, and even a day, a week, or a month can be less, but within a limited time of 15 minutes, I'd like to discuss few of the market modification strategies or case studies which have been done in the market, few of the product modifications which I have seen in past, and few of the marketing mixes used by other brand managers, or few of the industry case studies also I would like to discuss. But one thing which differentiates a marketeer from other people is converting any adversity to advantage, and that's what we have did in all the organizations where I have worked. If DPC had come, I have used it not as an obstacle, but it is an opportunity. So as a marketer, friends, I should always feed the opportunity and starve the adversities. If you feed the opportunity, definitely your field will take it up and the brand will shape into the bigger brand. So I'll just quickly share a few of the initiatives which I also was personally involved, or a few of the industry examples, case studies also. So first thing is market modification. So in market modification, what things we can do? So first in that is market expansion. So market expansion means reaching to the newer geography. So in India, we have around 25 to 30 states. So if a brand is all India #1, so it may not be necessarily that across the country in all the states it is #1. So as a marketer, I need to find that which are those big markets where I'm not performing. So that can add to the lever. For example, if I am #1 in India with 50% market share, but in Maharashtra, the biggest market is there, but I am not at the leader position. So can I do something and do a regional campaign and get that market share? So indication expansion, mostly the MNCs are doing this, but in India, in our Indian MNC context also you can do. For example, metformin, as Sanas sir was talking about, that it is largely used for glucose control, but it can also be promoted in PCOS. It has found to it has a role in that. Azithromycin, which is majorly used in URTIs and all, but it can also be prescribed in pelvic inflammatory diseases. So these are the small indications where they can give you 5 to 10% growth booster. They can play. But apart from this, there is one more thing which you can expand, that is perception. Many times a brand is perceived in one thing. For example, if you are handling a brand, and doctors always think that it is a very good brand in URTs, or it is a very good brand in SSTIs. But apart from this, there are 4 to 5 other indications also wherein this molecule is approved. So can I take, or can I expand to the perception of the customer to that indication? If my brand is being widely prescribed in URTI, so can I go to a doctor and tell, sir, in URTI you are using this, and thank you for that, for emanating the trust. But in SSTI also, sir, it is one of the best choice. So why don't you expand, or why don't you prescribe this in those infections also? So friends, perception expansion also can work. And apart from this, in key markets, if we expand our team, for example, not across the country, but if I have a East as my key or West as my key, so can I expand my team by 10%, 15%, and can I place my people at key markets so that I expand it and my market share increases? So the next approach which we can take is, friends, redefining brand positioning. So that's what I guess at the start only, even Arpanji also told that every marketeer, this pandemic has given a chance to renew, revive his learning. So if you see in the screen also, earlier the revital was used mostly in convalescence, but now they have changed it and they are into the energy foray. Sabki battery, right? So all these things are general, and every patient can take this to live his life to the fullest. That is Jio Ji Bhar Ke. And apart from this, friends, even I do not remember that earlier when I used to take regularly vitamin C. Whenever I used to feel sick, so during those times, we used to have vitamin C tablets at our house. But now, from last 1 year, vitamin C, be it for that matter, any nutrition supplement. So everyone is shifting from illness to wellness. So they don't want to get ill and then go to a doctor. Rather, they want to be on the wellness part, so that how my brand can contribute for his well-being. So a lot of social media campaigns are also being done. A lot of nutritional brands are taking this or converting this advantage to their brand advantage. So how can I think in that thing? So first is market expansion. Second is redefining brand positioning. So whatever is the therapy, there is always a chance to redefine. If you are looking in a small market, how can I make the market even bigger? So that's what it matters. And apart from this, friends, small changes in the product fall under product modification. If you see, there are few brands which do packaging differentiation. For example, I have seen many brands which deal into hypertension. They have some hypertension control tips. In lipid management, they have how to control lipids effectively, how to complete the antibiotic courses. So all these things, they do matter, and they are a part of brand building, friends. Definitely, these help differentiate the brand from the clutter. Apart from this, how can I make the pack bigger? So for example, as Sanatji rightly told, if it is adding to the patient compliance, the 15 days pack, or how can I make it to the monthly pack of 30 days? And a lot of brands, they got succeeded in this. If your brand, if the dosage is for 6 days and if your tablet is of 3 days, so can I change it to 6 days and talk in front of the doctor, sir, this is the ideal dose and this is how you can prescribe? Because in India, patient is always thinking, if 3 ka patta diya hai, then definitely I need to take only these. Apart from this, you can add few of the flavors. For example, few kids, especially for the dry syrup or the syrup part, where we are handling. If I have a strawberry flavor, can I extend it to vanilla or can I extend it to mango? So that there is a choice for your consumer. And at the start itself, it has been told that consumer or the patient should be at the core of your marketing strategy. Apart from this, friends, a few of the things which we can definitely consider for our respective brands, that is, can I have a new dosage form with the superior pharmacokinetics for my brand? If I have a tablet, can I convert it to a dispersible tablet? Or can I convert, if I have a dispersible tablet, can I make it the fastest dispersible tablet, be it 6 seconds, 10 seconds, 15 seconds? And can I have a demonstration in front of our customers? And definitely that gives us an edge. If I have some tablet which is which has size big, or a calcium supplement, can I convert it to syrup? So a lot of people have done it. If I have a antibiotic which is BID, can I convert it to OD formulation? Or if I have a painkiller gel or a cream, so can I convert it to spray with a better pharmacokinetics? So everywhere something should work, and it's a brand manager's responsibility to think how or which lever I need to take. And that comes only when you regularly go to the field, you regularly visit your doctors, and while discussion, these are the things where these will come. And if you interact or if you know how your patients are using your drug, so definitely that also adds to this product modification. So few of the case studies, friends, which I learned from my peers. For example, there was one brand which was ibuprofen. So from 60 ml, we changed with a new formulation of a strawberry flavor, and we came up with a 100 ml pack, and it helped to some extent to boost the sales. And we already had a pack in the carton pack, paper carton, but we changed it to the container. And when we visited the chemist and all, few of the chemists, they always keep the tablets in a small transparent container. So we thought that if I replace my box with a container, definitely this will help me giving to the retail push rather than giving a pen or a prescription pad, whatever, or a stapler. So this definitely helped us to push the brand at the retail front. So friends, apart from this, whenever I visit field, I could see that Dufelac, which was earlier 150 ml, 250 ml, now they have come up with 450 ml also for the chronic constipation patient. So that the patient is retained for a longer time, and there is a loyalty which has been developed. So one more brand which is in the biscuit. So they came up with a zero sugar formulation, and how do they inform the consumers? Unless the consumer is not going to ask for the sugar free. So they added a small leaflet in the current pack itself that there is a zero sugar SKU which is also available. So these are the small tactics which can definitely help or impact to increase or boost your brand sales. So apart from this, friends, other things which we can do, for example, which can bring edge over competition, like different marketing mix, like pack differentiation. So can I add patient education tips, be it using antibiotics, how effectively I should use, how to complete the course, or a hypertension tips, anything it can be. Can I differentiate my package from the competitor? Can I engage my patients through my pack. So in coming slide, I will show you how with the help of pack, you can engage the patient also, and you can ensure that your consumer builds loyalty towards your brand. So patient support programs we can do. So there are a lot of vitamin D brands which are doing a dose reminder campaign. If you just have to scan the QR code, and every week at the start of the week, and it's a very big issue with the people who take vitamin D. Every Monday they forget. So every day Monday morning at 10 a.m. you can get the SMS, have you taken your vitamin D dose? And definitely that can be extended to other programs also. So paramedical staff support, in my earlier company, we used to do a lot of paramedic staff programs wherein wherever the paramedic staff is involved. So how can I make his life better, or how can I train him to be a better professional? So on that we did a lot of series of videos so that they are updated, so that the life of a doctor becomes easy. Then can I have some pharmacist loyalty programs, like I 10-15 years back I used to see a lot of nice counters were there. So the chemist Dr. DR used to certify as a this is a nice counter, so that whenever you go you will be reminded that this is a nice counter. Then there are a few examples from industry which I have taken, that they have used pack very efficiently as a patient education tool. Friends, first was this calcium. So on the pack itself they have mentioned that what is the need of calcium. So if you just read that script, you will come to know, and definitely you will not miss your dose, and definitely you will have that craving that shall I have the one more bottle. So apart from this, other brands like Calcimex and all also, they have clearly mentioned, if your kid is not consuming 4 cups of milk every day, then definitely he is at the deficiency of the calcium. And during 1 to 10 years, the calcium deficiency may cause in leading to the weaker bones and all those things. So when I also read this, I repurchased it for myself, for my mother. And in the pack itself, though it was prescribed for my wife, but still they had written that it is safe for pregnant women, for elderly patients, to keep the bones strong. So that one thing triggered, and today one prescription has converted to 4 to 5 loyal consumers. Then apart from this, friends, on the pack itself, so this molecule Voglibose has to be taken along with the first bite of the meal. So on the pack itself, they have mentioned in regional language also and in English also, take this with the first bite. So definitely it will play a vital role that how the dosage should be taken. Then third is, can I use my pack with the help of QR codes, and can I add some prescribing information, or for that matter, patient education? So this is a wound management brand. So here, if I scan this QR code, definitely all the things regarding the prescribing information comes there. I have seen many packs where if you scan the QR codes, you have all the 9 languages patient education leaflets. So moving ahead, friends, this is one of my favorite brand because my daughter consumes it regularly. This is the brand which is prescribed for the first time, and if you open this pack, inside you have a bus, and it not only engages the patient, which was my daughter, but her father also. It took my 2 hours to make this bus. So first I missed also, and then I had to repurchase one more pack so that we do this mission together. So this is how the patient engagement we can do to the pack also. This is one of the very good initiative. And every time we buy a pack of this, next 1 or 2 hours, we are busy in doing all these things. So definitely it is a not only patient engagement, but also the parent engagement. Then to all the strategies which I have just discussed, few of the strategies which we can. So in one brand, we use this to, we use all the strategic interventions, and this brand from 30 CR to, it went to cross 100 CRs during my, and me and along with other team members were actively involved in this. So we did market expansion. We added few strategic SKUs like dispersible tablet, dry syrup. We divided the SKUs into 2 teams so that the promotion is focused. We did some differential promotion by doing virtual factory visits and all those things. And we did a campaign on register resistance. So, and when the 2014 when DPCO came, and that was the year we utilized it as an opportunity, and the brand won the silver category award by AICD AWACS. So apart from this, all the azithromycin brands 4-5 years back, they worked upon changing from 3 tablets to 5, because there was a study which tells that if you use this, definitely you'll have better cure rates in rhinosinusitis, and the resistance part is also less. Then we also did on thought leadership how the use of antibiotics should be done, how it should not be misused. So we launched it in the Epicon with the help of Mr. Sanat Sahu also, he played a vital role, and we added this line also on the tablet, that complete the course of antibiotic as prescribed by your doctor, so that the message is very clear to the patient that I need to take all these 5 so that the course is completed. So, and that played a vital role in winning an award in 2014. So friends, the take home is, we should not, as a marketeer, we should not ride along or defend the market. We should reinvent how that maturity or declining phase can go in the growing phase. Can I do some market modification? Can I bring some changes in the pack? Can I add some flavor? So anything it can be, but in consultation with the field, or the insight which you develop. And then routine promotion is always boring, I have seen. So can I innovate something which excites the field? And even doctors also are ready to give us those additional 30-40 seconds, so that the promotion becomes an interesting part. Then how can I convert every adversity to the advantage? I should not feed the adversities. I should always feed the opportunities, so that every adversity to the advantage. Then field is our first customer. We should always work with them. We should be a field collaborator. And then dream big, so that you can drive better and perform better. And last is brand manager or the marketeer is the powerhouse for the entire team. So with this small note, I would like to complete my presentation. Though in a limited time, I could cover a few things, but hope it will help all of you to build big brands in the future. Thank you. Yeah. So that was all about my presentation.
Thank you so much. Thank you so much, Sunil ji.
Yeah.
It was really a wonderful presentation, and a great insight that you gave to all of us regarding the brand plan. In fact, sir, to summarize what you said is very, very difficult, and that in this small length of time, but I'll try to pick up some of the salient points, the key points that you basically highlighted about a brand plan. The first thing that you said was about the importance of big brands, where you said that the top 300 brands contribute around 32% to IPM, which is indeed a very big figure. Then something I really enjoyed was the story of the 5 blind people who had never seen the elephant. So this is a wonderful way of keeping people addicted to your talk, because every big brand is just like an elephant, and everybody is watching through his or her window how they can make an insight about that. Now, about the product life cycle that you said about the start, the growth, the maturity, and the decline. And it is basically at the maturity stage that the product needs to go a modification or maybe a brand extension, so as to prolong the life of that product. And it was very well highlighted to all of us. Then one of the biggest hurdle for brand growth is about the mindset, because everything lies in the mind. A battle is never won on the battlefield. A battle is initially won in the mind, because unless and until you go to the battlefield with a mindset that I will win, we can never win it, even if we have the best of weapons with us. Now, sir, I enjoyed this line that you said, dream big, drive better, and deliver bigger. Wonderful. That was real and icing on the cake. And finally, you highlighted the key strategies to boost the brand revenue. And there you said about converting the adversity to advantage, market modification, redefining brand positioning, product modification, retention and loyalty, and patient engagement through packs. So, and there you said about how you made that bus out of the pack, and that was really interesting.
That's a chronic job I do every month.
Yeah, exactly. So that brings out a lot of innovation out of you, sir. But how can you utilize those packs in making something for the children? Yes. And that is exactly what also patient-centric marketing is all about, because you are thinking that what the patient can do with that. So that was an excellent presentation from you, sir. And I am sure our live audience on YouTube and Facebook have also enjoyed hearing your excellent presentation, and they too will be also ready with the questions. So now I hand it over to Yashwant sir if he has the questions for you, sir.
Thank you very much. Thank you very much, Arpan. A very good summarization you did, and really a wonderful session by Sunil. So question answer will take little bit late. Some of the participants who are very active. Let me recognize them. Kiran Verma, Ratish Srinath, Gopal Krishna, our own Hitesh Upreti sir is watching, Manoj Chaudhary, Mohammad Mustafa Shah, thank you very much Mohammad, Sangeeta, then Dhamman Priya Gautam, thank you very much, Arun Kumar, Arumugham, all of them have appreciated the presentation. Thank you very much everyone for appreciating, encouraging and coming live and sharing your thoughts. Questions are coming, I don't know whether to take or not. Ajit Ranasube and Ratish Sharma have asked question. One question I will take before going to our birthday boy. A question is for Sunil. A question is from Ratish Sharma says, why many companies are coming out same molecule with different brand in different division? Right, many companies, same molecule, different brand name, different division. What is the reason for that? If you can throw some light on that.
First of all, I guess a molecule is never for one specialty. Definitely, for example, if something is antibiotic prescribed in RTI, it can be prescribed by all specialties. But as a business unit, I cover only general practitioners or physicians. So maybe the patients are being missed in other specialties. To cover that, they are being passed to other specialties. As a design, it should never overlap. Sometimes it happens. That causes a lot of confusion. But definitely, the motto of the company is not to have a multiple brand, because having one brand is definitely a good profitable thing. But it should not create confusion for the field also, and for the patients also. It should be benefitable. So that's why we try to reach to the different specialties with the different branding. So that's the only reason what I think.
Thank you very much. Good insight. So we'll take some more questions after the Raman session.
Right.
So again, over to Arpan for a brief introduction of Raman.
Yes, thank you, Yashwant sir. Before introducing the birthday boy today, I will just like to walk on the road which Mr. Sunil said about the role of learning and development in a brand promotion or a brand management. Because one thing that always hinders our learning and development is ego, right? So let me just tell a very small story about how ego plays a very vital role in becoming a barrier between learning and development. Once a crow was flying with a big piece of meat, and it was just thinking, let me find a nice place where I can sit down and enjoy this piece of meat. But looking back, the crow found that a lot of vultures were following him, and it felt afraid that maybe the vultures are going to kill him. It wanted to fly faster, it wanted to fly higher, but the big piece of meat that it was carrying in its beak, it was preventing him not only from flying higher, but flying faster. So it was in a very dilemma situation when an eagle approached him and asked that, my dear friend, why are you sweating so much? Why are you panicking so much? The crow said, my dear friend, I'm trying to take this meat and enjoy it, but these vultures are following me. I think they are going to kill me. The eagle said, my dear crow, it is not you that they are following. It's basically the piece of meat that they are following. So the moment you drop this piece of meat, you will feel lighter, you can fly higher. So the crow listened to the eagle and dropped the piece of meat. And the very moment the meat was dropped, the vultures all ran after the meat, and the crow could fly higher, the crow could fly faster. And this is exactly this piece of meat that is there in our mind, which prevents us from learning and development. To improvise ourselves, to make ourselves upskilled, to make ourselves reskilled, to grow higher in our career, because something that prevents us is the ego, because sometimes we feel that that we are probably the most learned person and we do not need to develop ourselves. So let us throw that ego and let others take it, while we can make ourselves free and receive a lot of learning, so that we can not only fly higher, we can fly faster. So now let me introduce to everybody our own Raman sir, one of the founder members of LPC and today's honorable speaker. So Raman sir's first slide is ready. Raman sir is currently Vice President Marketing of Entod Pharmaceuticals and is based at Mumbai. His areas of interest are pharma digital marketing, marketing and sales management, telehealth and e-pharmacy. He is currently working with Entod as Vice President Marketing with a total of 18 plus years of experience in pharma marketing and sales. He has worked 12 years with Cipla marketing team. also worked with VHB, Nicholas, which is now Abbott India, and Ranbaxy, which is now Sun Pharma. He has launched Dharma, CNS2 divisions and the general divisions, and the therapies that he has worked are Dharma, ophthalmology, ENT, antibiotics, anti-infectives, CNS, etc. So Raman sir, it's all over to you, and we are eagerly awaiting your deliberations. Over to you, Raman sir.
Yeah, thank you so much for your kind introductions. This I felt a very novel way of the speaker introduction. This is the first thing. That is the working day, that is work, and the Sunday learning and development. And the second point is that this is the third and the last online discussion of this week. That live audience and the viewer must be happy to get set ready for the lunch after the session. So without not much taking more time with today's talk, how to how do we plan a new product launch in the new normal era? As mentioned at the beginning, the first point of the online discussion is a number of the pharmaceutical products in Indian pharmaceutical market are currently 50,052 products. Can't it be on the very higher side? And on the large way that we do have a lot many of the products in the majority of the therapies as well as the all therapies which has been required to a patient. And as covered most of the things in a Sanat presentations about the patient centricity, and in the Sunil presentation, the differentiations of the differential brands. So to avoiding these 2 points, I will stretch onto the what are the like the general ways that step that we should take into considerations while launching the new product. And the second point that we will also emphasize onto the specific to a pharma company, what are the like the steps that we should consider for the brands, and the again pertaining to a new launch product that we will say the just the name of the step in depth that we cannot go it because already we are running short ahead with the time, so we will make it the very short and swift this time. Once this look at the 50,052 products in entire India, which gives the value of 154, that is 1,54,385 lakhs crores. Like this is the currently the size, and as I said, it's a new normal era. Then the new normal era also is growing the tremendous rate, that is 4.3% is the growth currently. That is also we are looking at it. So in the IPM, it is valued as rupees 1,54,385 crores, and the retail sector was valuated by just the 8% lesser than this, that is the rupees 1,32,044 crores as on the MAT of the January 2021. And the MAT level, the IPM was grown by the 4% and the 6% at the TSA and SSA respectively. On monthly, IPM has grown by a 7% and TSA at 8% at the SSA respectively. Now, this complete entire the numbers, it has been like the boiled down with 25 therapies. This 50,052 products, it's catered to 25 therapies. So this therapies segments, it gives us the currently the lucrativeness of the launching the product. So which is currently the therapy that as like the we pharma marketer we can look at it. So of course the leading as well as the fastest growing therapy and the segment is the cardiology. Followed by that, the cardiology is the antibiotic, vitamins, mineral, and nutritions. Hepatoproductive products, that is we can think about launching the new products into the hepatoproductive, and the stomatological. So these are the therapy. But which are the therapy? Again, new launch product can be considered as a therapy which has like the very high basis. That is the respiratory, derma, gynecology, urology, vaccines, anti-neoplastic, immuno considerations that we can take it into consideration, blood related also. And the equally the brand which has been like the thing in the third way that we can look at it, where we see last 3 years the value contribution as well as the growth by derma as well as the gynae and hormones. These are like the the therapies and the specialty, it shows the lucrative ways in terms of the value as well as in terms of the growth. So we can think about it while considering the new launch product. And here in the second part, I will like to just mention the big value in the just last 6 months. That is the 455.8 crore has been added only by a two new launch product. That is the first product. It has been introduced into the Favipiravir with Faviflu as a brand name, and this is has a 248.5 crore value currently into a market. Big additions. And the second one is that is a tocilizumab, that is a Actimra brand name, added a 207.3 crores again on the huge side. Two brand just it was introduced the 5-6 months back and gave a lot of the market, right? So I thought that I will just share these two example of the new introductions. So how it's become the new the introduction has a big success into a market and added the value for the not for the organization but also for the current to entire IPM in terms of the value additions by looking at the 3-4 points. One is the patient need, current the market need, right way and right time the launching the product, and the as mentioned a lot of the things in the Sunil presentation of the patient sensitivity as well as the Sunil presentations about like the launching at the right time and the right way the products with the differential, it has make the difference. So once we'll look at this the different brands and the molecules where like the again it's showing the very lucrativeness into the respective molecules when we think about like launching the new product. First and foremost is the currently the food supplement, followed by the pantoprazole and the domperidone combinations, azithromycin oral solid, telmisartan, calciums, and the other like the lot of the anti-glaucoma drugs that can be think about like launching it. Then anti-epileptic and the combinations into the respiratory also it's picking up. The value and the growth which can be get it immediately apart from this is the anti-diabetic drugs, that is the glimepiride, metformin, the interacting long actings, the preparations, amoxiclav, and other iron preparation, immune protective, itraconazole. These are a lot of the molecules. It has like the opportunity to launch the new product into currently into a market. Now, once we look at this big brands, right? Most of the brands launch and make it big into a market. That is the anti-glaucoma segments and the therapy. It's has a good number of the brand, and as rightly mentioned, the percentage wise contributing 32% with 300 the brands out of the the thousand of the 55,000 and 52 products, right? So currently with this, if you look at the number of the molecule which has been the available, that is the 1,827 the molecules they are available into IPM, and the name I have mentioned already, which has like the lucrativeness. Every year 3% of the new product are introduced into the Indian pharmaceutical market. That means the average of the 1,500 to 2,000 products it has been getting introduced into Indian pharma market, right? So we will go on to the next step, that is the new product launch. Let's start with the second discussion point here. That I will go on to the general way first, because once we thorough with our the BPharm and MBA, then we come into the second, and then we thought of like the getting into the pharma, but particularly and the specific into it. So general way, which are like the steps that we should think first as a basic step into a launching the product. Then we will go on to the master way, the different steps, and maybe if time doesn't permit today, then in the next month, subsequent month, that we will try to go deep into again the certain steps that we have to be like the master into it to make the great successful products into Indian pharmaceutical. So here are the 10 product launch stages. Every the general way that the store should consider into increasing the chances for the success. First point, what I have mentioned is the meeting the user needs. Here our users are the patients in a pharma industry, and The customers are the medical fraternity, that are the doctors. The good product launch plan should always put the consumer need the first. That is the first thing. Satisfy them the best way, possible ways that we can think about it. And the effective way to do this is to do a survey in the market, answer the questions: why should someone buy your products? Figure out how your products could solve the problem, satisfy a desire, or the improve someone in the quality of the life. These are all the reasons why the patients should buy a product. What is your the products worth to your the customer and your consumer? That our customer is nothing but our doctors or medical fraternity, not worth in the way of the monitoring the value, but also how it's add the value to their the general state of the living. Understanding how your customer justify the buying your products, in how you can begin the product strategies. The first point comes in our minds that we have to go into a market, and then we have to discuss with the doctors, as well as we have to discuss with the patients. Then we get the insight from the patients, also that we get the lot of the insight and the information from the doctor too. Second point is the know your the competitions, that what sets your company and your products apart from the similar brands and the product. Why should the consumer or your the patient choose your the products over the competitions? What is there about the different examples that we can take into considerations of the different brands, and then brands now it's become the products, it has become the brands. It has like the differentiations in terms of the all the four P's older and the seven new three added along with the four, that is seven P's as like the new age for in your product. How can you grab the attention of your the consumer or your patients, so that the trust that your the product will be fulfilled? What other companies can do it? The third points, that third as a big step that we should think about, like the launching the new product, make the prototype and the test it, that we call it the market testing, to avoid the risk of the investing in the product that is the defective before it hits the market. Hire the beta testings to the try it. So we can offer the feedback on how to improve it if necessary. If it's required, then we should do it. This will help you the business understanding the customer or the patient's requirement, and a review that may be the damage your credibility in the industry, causing the partner and the inventory to do the damages control to having the justify their the involvement with your the products. So make your prototype and the test, do the test marketing. The test marketing is nothing but like the before launching your products, you can take certain samples, test it with the doctors and the patients, get their feedbacks, and keep this regular habit. Even though your products reaches to a maturity there, keep the taking the feedback from your the doctors, from your the patients. Now we will move on to the fourth point, that is reconfigures your the products. Once you start the testing your products and they gain feedback from the testers or the consumers, and the other the family or the nearby colleagues also, you can take their feedbacks. Anyone who can help eliminate the things into improving the adjust accordingly, that we can think about like the placing our products or the changing the way that market is responding to even the new launch product. Making the suitable changes here and there means the world of the difference in the products, in the quality, or maybe in the packaging, that you can make a lot of difference. Some of your the near to you, they can be asked about the features, what they could be never consider adding, and you will get the unbiased opinion from the others too. Ultimately, your product should the spark joy and the interest of your the consumer. It should be the sometimes consumer, not just the need, but it's also the one. As we have seen that two example which has been added the currently the big value into market, it was like the really the need and the want of the patients. Then the fifth steps that we should take into consideration is to run the number, that always we have to look at the profitability. It wishes to be establish your the profit margin as one of your the product launch phases. Look at your existing products performance, if possibly, and determine the number of the products sold, total revenue generated, because we have always the basket of the product. We have to be keep the balance aligned with the new launch product and our existing products. Both should have like the added the preferability in your for your organization. Then work backward to the figure out what the numerical goals makes the most senses. You needed to decide what to establish at the responsible the digital promotions. If you think about it, then you will have to like the step by step go into the digital ways of launching your the products. Six, the steps in the general way. What we should consider is the build the anticipation by the pre-marketing. Now here we will as per the more interest one-to-one as well as the digital that we will see it. The successful product launch plan is only the as good as the work your the marketing department put into it. And if you try to build the anticipations among your the audience by the promoting the product or the it's prior to a launch, if you do the testing, it is the awareness will be more prevalent and help drive more sales on the new product launches. The fewer clear ways to initiate the new products promo involvements, that general ways also that we can go. And nowadays the digital marketing emerging into pharma, that also we can think about like the put as like the my own promotional ways in the bigger way. Create the landing page about the new product on your the website. As we can see that the during the launch of the all the innovator products as well as the product which has a formulation developments, or the product which has been like the putting into the market as like their the availability or their reach, that all 3-4 category of these products can create the more buzz onto a digital marketing. Create the now in the current scenario you can have like the email campaigns, reach out to the more the journals as well as on the medical sites. Reach out to the the PR team also. It's like the helping to you depending on your budgets. You can go onto the advertisement media too. Create the contents as early as you can be prefer or copy image that you when your the products is ready to present. Really your the content of your brand communications that make the big difference while creating the big brand during the launch itself only. The next step will be build the solid supply chain. Now we have like the first a lot of the issues and the challenge for the supply chain. It is important for the business owner to take the inventory of their products and ensure that it's enough to meet the demand which has been like the going to create during the launch of the new products. So this also the demand versus your supply should goes hand to hand. These points also we need to remember, because this is what the big lesson that we have learned during the corona the scenario, and in this new normal this also become the most important step during the product launch. The best way to do this, establish the manage the supply chain, work closely with your the all the third party the supply chain people, those who is managing it, maximum the capability for the how many units they can be provided at a one time. Then the collaborative how to escalate the productions in the event that also the step that we have to be taken into the considerations, right? So the next the step what we should take into consideration as the general way, network and the share your the products. It's also the launching date, stick to it, so that once we create the buzz into a market with your the launch teaser, it should mitigate the requirement of the your the all the customer consumer what you are like the announcing them your promise. When it's time to the promotions the product, the all your pages and your promotional should be ready and reach to the most of the places post launch too. And the consider the public feedback post launch, that we call it the always try to make a mechanism of taking the feedback from the you're the patients, taking the feedback from your the doctors. Now as I said, there will be various category. So innovator brands, we will have to think first about like the overall disease understanding about like the brands or the molecule where we are going to launch it, whether it's like the first time India, first time words, as like the single drug or the combination drug or drug with the some differential formulations. Patient populations analysis that we need to keep into minds. As like the pharma products, it has like the different geographical need with the different ways, new ways of looking at the diagnosis and the treatment of the disease, that we will have to look at the diagnosis part also in the mind before the launching or the new product launch. as a innovative brand, these are the lot of the new steps that you can add into it. The formulation differentiate products, new formulation of the patient benefit for the better patient compliance, understanding the direct, indirect, the market short analysis that we have to always do for our products, for your molecule, for your organization, for your therapy, for your segments, all. Marketing the product, the product price track also we need to remember. As we know that this piece of the marketing, it has been improved from the 4 P's to a 7 P's of the marketing mix. That the older ways, the product place, promotion, and the price. This was like the 4 P's was dominating with each other. Now the 7, that is physical, people, and the process, also added the good value into the marketing mix. So not much more going into in depth into it because of the today's the time constraint, but of course in the coming sessions that one points in the deeper way that we will try to go into each. So these are like the basic step. Once you master into it, and then we will go on to the master our the discussions online in LPD through the LPC. So thank you so much to uh, the panelists as well as our monitor has given the sufficient time to speaker also got a good time this time, and we will have a sufficient question answer time now. Over to all over the two panelists and the monitor for the question answer. I will request
Thank you very much. Thank you very much, Raman. Really a comprehensive. This is very, very helpful for those product manager who are going to launch their brand, because after the lockdown is over and new normal, companies are geared up to launch the product. So step by approach, you have given the guideline that is good for them. So a brief about what you told, 2 or 3 points we will take. New product is a new normal is good, and you have given very good data that around 50,000 products are there in Indian pharma market, and the market value is 1,54,000 crore. Not only that, even despite all the setback and debacles, IPM is growing by 4.3%. That we can say in this situation it is a robust growth, right? Then you told about 2 of the molecules which were launched in this situation and made a big brand. Fabiflu 248 crore and Actrumba 207 crore. That is a really a good thing. So step by approach, you have told of new meeting user need, know your competition, and also recognize your product and run the number. Thank you very much. Thank you very much for giving an insight. I will go now to ICS Verma sir for feedback and recognition, whatever things we are getting questions from YouTube and Facebook. ICS sir.
Yeah, thank you, Yashwant, and
Yes.
thank you all the speakers, Sanath, Sunil, and Raman. Lot of insights into branding and legacy brand, and also like patient-centric approach. So we have a lot of appreciation coming from Facebook, especially our previous speakers like Kiran Verma ma'am and Arun Kumar sir, Ramesh Juneja sir also joined, and we have Amarendra Kumar. So he has appreciated, and we have also Ratnesh Srivastava and Armugam Arasan. So all these people and Gopal Krishna. So these were all Hitesh Preti sir. So they have a lot of appreciation. And I have one question to Sunil. Sunil, yeah. So I just would like to understand who are the stakeholders, important stakeholders in managing a legacy brand, because you talked about legacy brand in length. So you can unmute your mic and can throw some light on that.
Yeah. Thank you, ICSG. I guess this point is covered in bit, but the most important stakeholder, what I as a marketer think is, for me, though, my customer is field is my first customer, and for him, I should give the ways and means and the things. But I should empower him first, so that he can go and discuss it in front of his customers. So that for me, though, it is always my field, and for them to empower them, I should go to their customers, which is doctors and pharmacists and stockists, to understand what are the ground level issues, what are the ground level realities, and what is the execution level, which if I plan any activity, how it can happen. If I take them along with me, if I collaborate with my field, definitely no campaign or no brand would fail. It will always succeed. So all the credit is always to the field, because it's 1% of planning, but 99% all happens because of the execution. because of the hard effort which field is doing. And me being also I was a salesperson for 3 years, so it also plays a very important role to think. So for me, it's always a field. It's a very important stakeholder. For them, it may be a doctor or a stockist always.
Yeah, that is true. Exactly. This is what the real field experience. That's why we say that before you become a product manager, it's always helpful if you
Yes.
are in sales, because you
Yes.
understand what exactly their likes, dislikes, and these guys are actually going to take your all campaigns to
Right.
the
Right.
top. That's a great insight.
Yeah.
Thank you.
Thank
One
you.
question to Sanat I have. So
Yeah.
how to differentiate your Me Too brands, especially during this, when through a patient-centric approach or whatever you would like to, add, Sanat.
Right. Thank you for this question. Actually, it is one of the most, the way the generic market is moving up, the way the number of new brands are being launched for the molecules which are having good scoring point. I'll put a small example, the post-patent era, like Vildagliptin in December 2020, this 10th December 2019, Vildagliptin has gotten off patent. Prior to that, because of the patent, only 4 companies were promoting for almost 11 years in the market. And I'll cite an example like Galvus being the product of Novartis, their research molecule. They were able to enjoy that premiumness with the rate or with the potential of the molecule. Post patent, 20th November 2019 onwards, the market has been flooded with almost 80 odd players. So if everybody is going to talk that how vildagliptin is a better molecule in the controlling the glucose level of a patient, for a doctor, it is very difficult to recall which brand to prescribe to which patient. So differentiating your brand in the Me Too market is actually required. Otherwise, you will not be able to get the mind space. If the brand is being a third-party manufacturer, you will not be able to get those benefits or add-on advantage of having a differential packaging or differential size of the tablet or flavor or something like that. So there, the marketer has to play a very vital role in identifying that how to make my brand something very differentiated as compared to the other 90 brands which are available. So I'll put a small example over here that where I was part of this, an emotional connect is required. I'll cite an example like Will Act is one of the brand which have been launched with Vildagliptin. So Will Act, VILACT. So it is about the emotional campaign which have been developed that I will act. And the current scenario demands that I will act against pollution. I'll against usage of polythene ban. I'll act against use of vehicles where it is required, to overcome air pollution. I'll act against that how the water pollution can be. So Will Act was a campaign before the launch of the brand. Actually, it has hit the market. For 4 to 5 months, the doctors have been communicated emotionally in that the current scenario demands that I need to act. If I will act, everybody will act. If I'll stop using polythenes, then definitely everybody related to me or my surrounding will stop using polythene. So Will Act was a positioning which have been created in my customer's mind that I'm able to differentiate with the other 90 brands which are available on Vildagliptin, which are going to hit the market. So that mind space I was able to build in the first five, 6 months of pre-launch. So you need to understand that how the approach is required, to differentiate your brand. In the Me Too market also, you have to come up with a solution that how you can get more space. And even that same campaign we had run for the chemist also, for the patients also, from the doctor to the patient. I'm not using polythene. So my advice to the patient is that they are not going to use polythene. So that chain we have developed, and we were able to come closer to certain set of group of doctors with whom we had run this campaign. So this is one of the things which we had done with the live example which I had stated. So you need to differentiate, otherwise you will not be able to get that mind space.
That's really truly wonderful. I think this approach now pharma is adopting, because we have seen this in FMCG long back.
Right.
They actually focus more onto the consumers, but now Pharma is fortunate. The COVID has accelerated their approach. Now you should have different approaches to make yourself stand apart from your Me Too brands. And patient centricity is really a great way to connect with the patients. And thank you, Sanath. Raman, so I have one more question to Raman. So Raman has discussed about Actimira, which is actually launched by Cipla. It's a Roche in-licensing product, and majorly the success is because of the COVID. Most of the patients who were the severe COVID patient has been used it, and it was a great success. But also I know that Raman or Entod also launched some products. So what approach you you have chosen, especially during this COVID, to make your brand launch and successful, Raman? Can you show some light on that?
Yeah. So this week on Wednesday, right, our managing director Kishore sir, he has received the award for our Phenogen Plus, that is the new launch product in the innovative category. So in the innovative category, Phenogen Plus, it has been received the best innovative brand launch during the pandemic era in this year, which has been received recently into Hotel Tajland in Bandra, and it has been most prestigious award that we got it. So we feel proud about it. The not only this one brand we have introduced it, but along with that there are the 4 more products which has been introduced in the last 6 months that has been on the base of the formulation differentiations. So why this product it has got the innovation award? The number 1 is exactly at the right time identifying the right need of the patient and addressing it on the very faster speed way. That gives you the added advantage over all the competitions what you are going to host for it. Number 1, that product it has been introduced into the cataract the surgery category, where normally that we do uh, the the eye drop for the dilations, but this product it has been like the intracameral use for the pupil dilation. And this product it was like the wonder, first time in India that we have introduced this product in the month of July during the pandemic era, and got a good acceptance by the doctor. Now the question may be coming during this era how we have introduced this product where the field was not working. So through the digital way that we have introduced this product, and this product it has been launched through the mailer campaign as well as on the webinar, all the web platform that we have utilized it, and it has reached to a 2,000 doctor on the one-to-one basis through the online platform, as well as consistently, continuously every day that we are conducting the virtual advisory board meeting CMEs, because it's a technical product. It has to be launched by the doctor to doctor. It has been done very well and got a good business. Now, the second, the category of the product where we have introduced the 4 products, existing molecule, but has like the added advantage over the others. All are available in the eye drop formulations. That eye drop multiple times that you will have to touch 2 tips of the eye drop, and the 30 days that you will have to utilize when it's like the SOS basis. So in the past, most of the companies they had the unims, but that has not clicked well into Indian market because of the non-acceptance of the patients to a cost. And that is the one thing. And second thing is the handling of the unims was very tough and difficult that time. But during this corona the situation, this formulation it has got the well acceptance, and the right time we have introduced it, and this most welcome by the majority big hospitals like the LV Prasad or the others, the Shankar Nethralaya, of the all major institute of the ophthalmology in India. It has been well accepted and got a the big way entry into it, because this was a need address at the right time.
Yes.
By the
so even the formulation was available from the past.
Molecule was the 20-30 years old molecules available in the eye drop, but the it has not the well acceptance in the past, but in the current scenario it's a well accepted because it reduces the chances of the contaminations by keeping the minimum touch to unims, because minim is the one time usage, just because it's all the sterile product. I don't know, all sterile, you use it and throw it. That's
especially when the COVID hit, people were more health conscious and they were very conscious about the hygienity. So that has been utilized.
And most important is the safety profile of the patient in the corona situation. If you are offering any dosage forms which gives the on the higher way the safety to a patient, what else that you can? Because eye drop for the dilation, you will open it and you will use it for the 15 patient. Maybe the tip, it can be touched to the patient which has been contaminated with the virus. So how can you judge on the basis of that? So one time usage of the units, it has been clicked into a market. So
as
a great example that we have it. Not only this, but we have
pre-filled formulations have done well, right?
Yeah. So apart from these 5 products, we have introduced the six more products, which has been like the helping to a patient to boost the immunity, like the anti the our vitamin mineral supplements is taking it, and the antiviral drug also. It has been just revamped into the packaging and the differential way. It has clicked into very well way into.
Superb. Thank you, Raman. And this resonates with the Sunil's. Sunil was already addressing that when DPCO hit, most of the companies were actually shaken. What will we do? Because our brand was selling around 80 rupees. Now it has come to 8 rupees. But it was an opportunity for the organization, and to reach the wider market, you have to use your strength, and at that time Cipla's strength was the distribution, the reach. So that has been utilized by the division which where Sunil worked, and they have capitalized it. Yeah, it's a great case study, in fact, on brand building by Sunil, Sanat, and Raman. Thank you very much, guys. We were really lucky to have all of you.
Thank you, ICSD, and Yashwant, Raman, Arpan also for giving us opportunity and making this a wonderful experience for all of us.
Before we close, 1 or 2 more questions, and then we'll wind up, and we'll take home message from everyone. First of all, there are some people who have appreciated some of the PMT colleagues. Vikas Munat has appreciated the course. We all know Vikas Munat. Right, thank you very much, Vikas. Ashutosh Mishra and Jitendra Inge has particularly appreciated Sunil's presentation. Thank you very much, Jitendra. And Ajit Ranasube, many people have asked question. One question of Ashutosh Mishra I am taking for all the speakers. They feel, because most of our viewers are from sales line, they feel that of late PMT's connect with the doctor is missing. What our field people are facing, this is the question from Asutosh. We feel that nowadays PMT is not connected with the doctors. So the question is, how do you see this? Is it true, or what is the importance of PMT being connected to the doctors? So I can take Sanat first. Sanat, what is your thought on that?
I feel that somewhere something has been missing. I feel with the course of time, the connection with the customer is more and more robust nowadays. Earlier, the doctor was also expecting a PMT or a head office person to come to his clinic. And today, with the corona cases in last 1 year, the getting an appointment of a doctor through a digital communication, maybe a WhatsApp, maybe there are digital applications like Physi and all, which my company right now have. So connecting with the doctor is more often and is very frequent nowadays. What my colleague had asked, actually, I'm not able to understand how he is.
Physically, you are not meeting, but virtually you people are meeting. Physically, you are not meeting. Got it.
Last 1 year, it was really a house arrest. Everybody was there. So moving from one place to other place was difficult.
So Sunil, what is the importance? Do you think PMT should be in touch with doctor? Your thought on that, Sunil?
Yeah. No, definitely PMT or every person who is associated with marketing, he should be involved with all the specialties wherever the brand is used, because they are the ones who give a real feedback, real patient thing, what are the side effect profile, what is the efficacy, and sometimes they also suggest few of the things which actually click, and it's a thing of a marketing person who should read between the lines what he wants to say. He will never say that, for example, you add water for injection, for example. Or water for reconstitution. It's we who need to see that if doctor is telling whenever I'm giving this dry syrup, it is very inconvenient for the patient to go boil the water, then cool the water, then filter the water, and then give it to the patient. By the time, if a patient is there in the clinic, the kid is crying. By the time the mother goes to the hospital and to the home and she gets the medicine, it's almost an hour. So it's the role of a PMT who reads between the line that in my pack I should add water for reconstitution, which is ready to make, and so that in clinic itself the mother should give the dose to the tab to the kid. So those things come only if you are in connect
customer's mouth. Yes.
And you should read in between the lines. Nobody would tell you to give the chronic therapy as 30 days. If he is telling you the compliance is not there, patient 10 दिन ही खाता है, फिर if it's an antibiotic and the patient is purchasing the 5 strip and he's eating, or he's purchasing a 3 strip and he's only taking the 4 or 5 tablets. So whether I should go for 4 tablets, 6 tablets. So we should make it as per the therapeutic thing which is required. So we should always read between line, and doctor connect is very important. That to top doctors who can definitely make or break the things. So that is very important. And as Sanaj has already told, maybe the physical connect would have got less, but at our level, we have ensured that at least digitally or through some other ways and means we are connected, and we are regularly getting the feedbacks from them how it should happen. So maybe initially they would have got irritated because a lot of people were bombarding reminders, webinars, everything. So maybe initially 1 or 2 months that was a miss, and that was intended because we also thought we should not disturb now. So now everything is normal. We are connecting on regular basis.
Right. Thank you. You got it. So Raman, your thought, only webinar is important for doctors, or a direct connect in entered you are having a direct touch also? Yes.
I don't know, because of this new normal era or maybe the pandemic era, this question maybe arise in the mind of the audience or the
Field force.
it is a large team of the sales or whether it's the product management team. It's all along with the other department. This is a part of the marketing, and the best marketer are those marketers, those who is there into a market. And how can the question arise like without the market presence of any marketer making any plan into a marketing? It's not possible. That is the first thing. And second thing, if the question has arise due to this the corona situation, I will just address to the field colleague. Both the touch are very important. Both the touch are the required, whether it's like the corona situation or not corona situations. In that situation, both the touch are the required, because the one-to-one touch is over the traditional touch. It gives the humble, polite, or the expression or emotions that you can put forward to the customer. That is the one thing. And also you can analyze the customer, the way that they are reflecting the behavior by hearing your each sentence about the product promotions. That is the best benefit of the one-to-one. So we cannot be run away of the one-to-one meeting to a doctor. Second thing is now we do have the platform currently with us, that is the virtual platform. And if I was meeting to some around 20 or 30 doctors and in a one-to-one per month, catering to the all specialty, all division. But nowadays it's possible to interact almost the 2 times more than what we used to meet it to our customer at the one-to-one. So if I was meeting 30 to 25 to 30 doctors in the one-to-one per month, now I'm along with the virtual, I'm meeting to close to 150 to 100 doctors every day. I will say every day. Out of that, maybe we are doctor allowing us to conduct the con call, which is not been like the possible. Zoom meeting is the continuous meeting. They are not normally habitual with it, but con call is the one appreciable things which has been well accepted by the medical fraternity. I will thanks to all of them, because they are coming onto a con calls for the general discussions with a marketing team. So that's how we wanted to become the successful. That's why we always associated the market, and market is meeting to patients and the doctor, both of them. Not only nowadays we are meeting to doctors, but we are taking the insight from the patient also. Once we go into a market, we are meeting patients along with the doctor, and we cannot neglect the chemist and the stockist visit. Also, we has the normal way. So this is what the current scenario that we do have.
Thank you very much. Good insight.
People now.
Good insight, every speaker. Thank you very much for throwing light. Actually, some more questions were there, but due to time constraint, I'm not taking this question. Ritesh Sharma particularly asked many questions. Ritesh, I will take your question in maybe other episodes, or we'll address it later on. So thank you very much, all of you, for joining. And as a token of recognition, thank you very much, all the speakers. As we are closing, a parting shot from each one of you. Take home message from each one of you would like to have. So Sanat, first yours, take home message for the viewers. Sanat.
Yeah, the big learning. Yeah, thank you for giving an opportunity. The big learning is about sharing. For developing this presentation, for developing this communication of half an hour to 22 half an hour time. If I'm not wrong, I had spent almost 3 to 4 hours in collecting all the things in my last 15 years, what I have done. Maybe in my early days as a medical representative, what I had done, and how to, in the hypertension therapy, when I was taking care of, what are the things which I can give live examples. So I'm really thankful to you for giving a platform, and to all the audience who had created once again the seriousness to have a recap of my last 15 years journey. I'm really thankful.
Thank you.
Stay
Thank you
blessed
very much.
and stay safe.
Thank you. Thank you very much. Sunil, your parting shot to the viewer. Thank you very much.
Yes. Yeah, thank you so much for giving the opportunity. But one thing which I always shared learning. So today I learned from Arpan few of the stories. From you also I learned few of the things. So when you are learning something and we are learning with along with the peers, so definitely you'll end up, because it's always the same way. If I have a coin, you have a coin, and if we both are together, we have 2 coins. That means 2 ideas. So definitely sharing is caring, as Sanaju, I would like to re-emphasize on that. So today was a day, I guess. I also spent a lot of time learning, because if you cannot teach or share something in a way which team or people cannot understand, definitely then you are not learned in the right way. So definitely it took some effort of me also, that how easily or how visually I can show all the things which I imagine. So that was a thing. Definitely, thank you so much for providing me an opportunity. Thank you, ISS Verma ji, Yashwant ji, Raman, and Arpan ji.
Thank you very much. Thank you once again. I'll go to Arpan now. Arpan, your take home message, any key learning? Then I'll come to Arpan. Yes, Arpan.
Thank you, Yashwant sir. In fact, we have all seen COVID-19, and I believe COVID-19 has been the biggest teacher for us, because it has transformed adversity into an opportunity. It has transformed the physical into a digital. It has transformed the illness into a wellness. And the basic necessities which we always said were food, shelter, and clothing. The fourth has been added, that is internet data. So these are the learnings that COVID-19 has given us. And obviously, it has also given a lesson that we should keep our minds and hearts open for learning and development. And every corporate organization should transform itself into a learning organization. So I think that is the take-home message we can have from LPC-43 Young Platform.
Thank you very much. Thank you very much, Arpan, for the expert comment. Now over to ICS, sir. Your key learning, and then we'll close.
Yeah, thank you team, first of all, for this wonderful show. And there was a lot of learnings today, and in every session, and keep rocking. And I congratulate Arpan for taking up the young LPC. So keep doing well, Arpan, and because it's for a greater cause. We have been all doing, like Meenakshi ji, Yashwant, Vinod, Raman. So it's a great team. Have a great time together. Thank you.
Raman, your parting shot, Raman. Once again, many happy returns of the day. Enjoy the day. Party is due.
A great time.
Thank you so much, sir. Most of the things have been covered by the Sanat as well as the Sunil, not the overlapping with the same. Just one point I just wanted to mention it, whether the product launch step need to be keep the patient at the center, and need to be think by all the marketing manager as well as the product manager which is there into a pharma industry, that they have to keep that point in the mind. And there's very few the certain steps which has been like in the form of the implementation that need to be taken care by all the field colleagues. So they also have to be keep the patient at the centricity of the new launch product. So this is what like the one message that I wanted to give to all of you. Thank you.
Thank you very much. Thank you very much, the viewers. Keep in touch and keep on encouraging us. Thank you, all the speakers. All the best.
Thank you.
Thank you.
Thank you.
Thank you. Great weekend. Thank you.